They truly don't set you up for the violence that you see, the aftermath, the feeling of loneliness, the feeling that when you transition out that you no longer have somebody to really talk to.
When Crystal Cordero came home from Operation Enduring Freedom, PTSD followed her, along with military sexual trauma.
I unfortunately had an officer who tried to take advantage of me. He did not succeed, but nonetheless, I did have to suffer the assault.
For years after coming home, she endured what many veterans have experienced, having to jump through hoops to get the prescription meds to treat their conditions, hoops like step therapy or needing prior authorization.
It's almost like you're dangling a treat in front of them and you're saying almost there, but not there yet. And we're tired of chasing things. We need to be heard.
Next week in Trenton, lawmakers will discuss a bill that'll look to make it easier for patients with serious mental illnesses like PTSD, schizophrenia, bipolar disorders, and others to get the medicine they need by requiring prescription drug coverage without prior authorization or step therapy, a method of having patients try a less expensive drug first.
It's long overdue that our policies protect access to critical prescription medications for folks suffering from serious mental illnesses. And insurance companies, through step therapy protocols, have been blocking access to those critical, potentially life-saving medications. It's time we put an end to that practice today.
We want to make sure that they receive the help that they need as immediately as we can get it to them, because the loss of life is never an option.
According to the National Alliance on Mental Illness, the average delay between when symptoms first appear and intervention is around 11 years.
You really don't want to add in another roadblock of, I can't get the medication I need, because it discourages the person. It breaks trust that they're trying to build with the providers and also the family members who are probably saying, we want you to get help.
The bill is set to be discussed in the Senate Budget and Appropriations meeting in Trenton on Monday. For Pix 11 News, I'm Jim Vassell.